Good morning. It's Wednesday, October the 30th, and this video is primarily about Sampson's article, A Neighborhood of Facts. I wanted to walk through that in some detail with you. But it's also just to talk about a couple of other things. First off, I want to compliment you on the extent of the discussion, very good discussion related to the income inequality segment that we just sort of are completing and beginning to move. We're already in the social cohesion segment. I'm going to go back up here in a little while, and it's about 9 in the morning on Wednesday. Once I get this video done, go back up to our website and make some comments in that discussion. And I posted a thread for social cohesion, and sort of get into that. You probably haven't gotten into that one too much yet. And excuse me, grade the papers that are posted that I haven't graded yet for segment 2, and then I probably for the post a discussion on social networks. These are how we would describe as the fabric. We've gone from the Y variable of segment 1, how often health is defined by or characterized by health outcomes characterized by events, demographic events of birth and death and features of those events. The second segment, again, ZI, was income inequality, and there was clear relationship we saw in that, particularly if we looked at Robin Hood Index. And then the idea is that really it's probably not income inequality, it's about the disaggregation or disintegration of cohesion and the stress that comes with that really implicates the autoimmune system, and that's really sort of the topic of social cohesion. So we're looking at relationships of health and social cohesion, where social cohesion is high, autoimmune system, our stress is low, autoimmune system is not quite so implicated, and health outcomes are better. And then when we get to the last segment, social network, that's the fabric. So it's not about cohesion, is it? It is, but it's about the integration of connections, the degree of connections in social networks, not just for both shall we say, just human communication and all that, but support networks. If somebody is not doing well, like the elderly in the family, somebody is a caretaker and all of that, or you might have a good friend that looks after something if you're not feeling so well, or just the fact that you've got a good network, that keeps you connected with the world and doesn't isolate you. I think so. We'll have a bit of a discussion on that. I'm also going to post a discussion thread later today on the comprehensive essay, and that I'll speak and post it as an assignment, and I'll speak in more detail than what is just in the brief outline that's in the syllabus. But I think it's real important for you to be already beginning to think of the topic that you want. You'll find that there are a range of topics, and you already found that, I'm sure, in the readings. Things that vary from mental health issues related to women who are mothers, and also in the workplace, the stress that causes, or things having to do with coronary heart disease. CHD is a marker for stress, as many of you know. But anyway, anyhow, anywhere that you want to go out of this as a topic is okay with me. Please email me what your topic is. But more importantly, in this discussion thread that I'll be posting later in the day about the topic, we'll have 2 for the remainder of the semester. One on the networking, and then one on a discussion on the topic for the paper. Put your paper idea out there. Be collegial. Talk about it. This is what I'm thinking about doing. This is the things that I'm pulling together to make it work as a comprehensive essay. It's as though we were sitting around. We're undergraduates, but it's always good to think of it as sitting around a seminar environment where you're not isolated doing this on your own, but you're sitting there and bouncing ideas off your classmates and your colleagues, and me too. So I'll post that later and encourage you to get into that. Okay, and as soon as you get an idea for a topic, email me, as well as put it in the discussion. Now, email me and just let me know what's going on. I'm not going to say that's a crazy topic. I'll probably say that's a good topic. But there might be something that I can say to you that, if I'm thinking about this and I'm not real sure how to really specify it or express it, and then I can come back and give you a couple of hints. Consider me as a consultant, if you will, in the development of your comprehensive essay. So anyway, you'll see something a little more specific, not too much more specific than what's in the syllabus, but maybe a little more direction than what's in the syllabus, and I'll post that later in the day. Okay, neighborhood effects. Now, we've gone through a whole series of geographies here. We've looked at national differentials, comparing one country against another. We've compared states, one state with another. A lot of these things are at the state level in the U.S. There have been counties, geographies. There are municipal comparisons, urban area comparisons, and as levels of geography. But really the idea is to try and get it down as close as one can to the immediate context. We're all influenced by all those things, absolutely. What's happening in the world, what's happening in the country, what's happening in the state, what's happening in the county, what's happening in the city. Those influence us as we influence those factors as well. But to get down to the neighborhood and be able to characterize the neighborhood in a good way, or say an efficient way, so we can understand what its dynamic is, with the idea of being able to measure its effect. And that's really what this paper is about. Let's kind of walk through this page by page. I think the basic thesis here, if you've read it, it's a bit dense. I don't know, it's a bit of a struggle maybe to get through. But I think the basic theme is, historically in public health and in the social sciences, the way that we've characterized neighborhoods is the census tract. The census tract from the U.S. Census that the census used to enumerate the population every 10 years. The census tract in the early days, like here in San Antonio, were based on old social area analysis concepts, how you can aggregate features of the demographic characteristics of population to find some geographic clustering of demographic homogeneity. And then they would put boundaries around that. And often they didn't really have to do much about putting boundaries around, because neighborhoods often were defined by natural boundaries. A railroad track on one side, a major street on another, a stream on another would create a 7 or 8, 9 block area, and it would just happen to be a natural sifting device, if I can put it that way, where people inside that area would be more like one another than they are like anyone outside that area. So there was a natural formation of neighborhoods, and in neighborhood dynamics and urban sociology and urban ecology, that's really the way we think about them, as natural areas. And so when the census put tracts on San Antonio, for example, they just simply drew political or legal boundaries of the census around those natural boundaries. And what was a natural boundary of track, railroad track, and a highway and a river became the boundary of the census tract. So when these places were initially bounded, they were homogeneous. And but as time goes by, the sifting process, people move in, people move out, the demographic features change, become more mixed. But nonetheless, for the last 30 or 40 years, census tracts have been proxies for neighborhoods. And they have served good value, they have worked, but they're not as precise as perhaps one would like. And so the idea has been to, and the other thing is that the demographic features of the census tract are characterized every 10 years. Well, things can change in 10 years, especially in the last 30 years, things move very quickly. So a census tract of 2000 or say 2010 can almost add the data or features of the 2010 census tract can already be out of date now in 2013. So there's been some concern about how can we look at this in a more effective way, and that's what this paper is about. How can we identify social processes? And that really those boundaries that we have as census tracts, and perhaps even the boundaries in the original idea that were natural areas, were not really boundaries in the sense of being impermeable, but actually there were processes extending across the track, across the street, across the stream, over the bridge, and all of that. that these were very arbitrary designations, even as natural areas. So the idea is to try and capture the processes. And that's really what this paper is about. How do we see the natural processes of ongoing neighborhood formation? It also takes into account that neighborhood extends work neighborhoods. People may know people in the workplace better than they know their most immediate neighbor. So all these kinds of dynamics have transformed urban ecology and urban sociology about how to understand this, and public health as well, because those census tracts are often used at the sub-county level for measuring health differentials across the urban environment. Okay, and you'll see in here that there are, even in the title, social processes and new directions in research. The whole thing is about identifying social processes. You'll see on the first page, Sampson and all are talking about how little this has been done in the past. We've relied heavily on the more arbitrary kinds of census tracts that have worked well, but we need to do something more than that. And you might think of, in terms of an equation, we like to think in equations, do we not? So when you have health as a Y outcome, then the X that influences that would not be the features of the census tract, where X equals Y, or in other words, health outcomes equal demographic characteristics in the census tract, but we would substitute that for social processes. And if we go up our equation, then a way of thinking about this in ZI, our famous ZI, is that not demographic features from the census that characterize the ZI of a neighborhood, but how to capture best the social processes, the dynamic, the moving phenomena of influence on people and people's influence on the phenomena that happen in neighborhoods. That's really what this paper is about. And I think if you keep that as your filter as you read through it, some of it will, well, a lot of it will make sense. Probably a lot of it is making sense, but that's, I think, is a good way to guide your way through. And you'll see in the first 2 or 3 pages in the introduction how we need to move beyond the census tracts, how researchers typically define local communities. What is a neighborhood? Well, we've used census tracts as a proxy. Articles that use neighborhood, in that Sampson's article on social capital, and many of the others that he's written that we're reading, they use census tracts as proxies for neighborhoods. They get data out of the census and then do their statistical analysis and determine whether or not dynamics in the neighborhood as reflected in the census tract are actually influencing outcomes. So trying to move beyond that. And then over on page 445, defining neighborhoods, we think of neighborhoods, he says here in that end of that first paragraph about defining neighborhoods as ecological units nested within successively larger communities. Ecological. This all comes out of the old human ecology idea, and human ecology came out of ecology. Creatures, as I suppose we could say that we are. We birds of a feather flock together. And that was the origin, perhaps, to some extent, the old racial segregations that we had, and still do have it, at racial and ethnic segregations in urban areas in our country and in different places around the world. There's a lot more mix now than there ever was before, but ecological units, neighborhoods are nested within a region of, say, the neighborhood on the west side of San Antonio, a 4 or 5, 6 block area, is nested within the San Antonio the west side sector, which is nested inside the city, which is nested inside the county, which is nested inside the region. South Texas is nested within Texas, is nested within the Southwest, is nested within. You get the picture. And that these are all hierarchical layers, and influence goes up and down, and are influences that ought to be taken into account. So that the neighborhood on the west side of San Antonio is influenced by the sector of San Antonio, of the west side, and then the west side is influenced by the city and all of that. Neighborhood differentiation is a theme that how to characterize it, ways that have been characterized, and you'll see the social ecological literature about halfway down on page 446. Life cycle status, neighborhoods moving from younger people. The children grow up and move out. The parents become elders. They depart in one way or another. Then the neighborhood is taken over by younger people, and the cycle begins again. Residential stability. People buy their homes and embed themselves and buy into the neighborhood and create some stability and advocacy for the neighborhood. Home ownership. Population density. How dense is the neighborhood? How many people live in the neighborhood? How dense are the and all of that? And heterogeneity. Are the neighborhoods diverse, or are they more focused on a particular racial or ethnic group? These have been factors that have been used numerous times in the literature to characterize neighborhoods. So I think you'll find some interesting stuff there that will kind of inform you and how to think about neighborhoods. I think if you were wanting to write a paper on neighborhood effects, this would be the place that you'd want to begin, and then try and figure out how you could frame that essay. By the way, the essay doesn't have to be something on a specific health. It could be a theoretical or a methodological essay. You might want to write an essay on neighborhood effects and how best to do it in terms of some interest to you. That sort of thing. Anyway, you'll find a number of bullets at the bottom of that page. One thing that's kind of an interesting way to look at it, if you were to geographically map this, which I do in a GIS course the students do in the spring, if you characterize each neighborhood or cluster of census tracts, where we can find them as kind of homogeneous, and we characterize them by socioeconomic status, which is a mix of education, income, and occupation, then you create an urban mosaic where in a scale of SES is now horizontally distributed across the urban environment, and each mosaic piece has its unique color that represents where it is in the SES scale. Now, some of these mosaics will be similar in color because they are similar in SES, but it puts together a very fascinating visual image of an urban environment that looks like a kitchen countertop of tile mosaics. And we refer to it as an urban mosaic. Excuse me. So anyway, on page 447, they begin to look at things that are more like social processes and mechanisms, and how these are best described. Another way, just back up for a minute, analysis of variance is a very important statistical technique in any case for bivariate relationships where you've got a continuous outcome variable and you're looking at the average of that continuous variable across categories of a categorical variable as a predictor. For example, you've got income variation, and you do analysis of variance to see what the average income, and gender is your predictor variable. What is the average income for females and the average income for males? And then analysis of variance will predict or test the statistical significance of the differences, the difference between the two means, one for males and one for females. In a way, there's a spatial ANOVA, analysis of variance, that we use to test the differences from one neighborhood to another on some continuous dimension. It could be a rate of health and how it varies categorically across neighborhoods and that sort of thing. This sort of a spatial analysis of variance once you display this as a urban mosaic. And always keep in mind when we're doing this that we're recharacterizing at this point. We're thinking about the ZI, social cohesion, and social cohesion is about interpersonal trust. It's about associational behavior. It's about reciprocity. It's about social processes of interaction, and how do we capture that without doing the arbitrary containment and definition of it that comes out of the census features and boundaries, demographic features. That's really what we're after. Now, you'll find in here a reference on page 449 to ecometrics, an article that we've walked through already, And really that's what this is about. It's an extension of that. How can we measure the ecological niches, if you will, of neighborhoods? How can we measure their effects? This is an ecometric exercise in this article. It's an extension of that. In fact, you'll realize, I'm sure, that Sampson's a co-author of both of them. He's the lead of this one and a co-author with Raudenbush in the other. So we're looking at how can we systematically measure neighborhood effects by looking at processes. Just keep that in mind as you work your way through this. And you'll find an extensive list, sort of historical, let me just hold this up, of pages of articles that are out there where different attempts have been made, numerous pages, probably nearly a quarter, if not half, of the article, which you might say, that's a relief, it's not near as thick as I thought. And they're probably not of interest to you unless you're really into this particular neighborhood effect thing. And if you are to write a concept paper as a comprehensive essay or a methods paper, then you might want to exploit some of those as a lit review and write an essay on something that you find fascinating about neighborhood effects. Neighborhood effects on the establishment of a clinic where there might be RNs, for those of you that are in the nursing program. If your interest is being in working in community health, say, as opposed to an institutional dynamic in a hospital or something like that, you might find that very interesting. Social capital, social ties to interaction on page 457. We've begun to talk about social capital. He has a good article in there, Sampson does, and that is beginning to look at this as a transitive thing, where there's action being taken, not just a fixed, but operationalizing social cohesion into social capital, looking for the social processes that represent social capital, things that bring people together, things that may push them apart, all the dynamics in a neighborhood that we can try and get our minds around as researchers and practitioners that we can use to more effectively measure health. He calls it collective efficacy. How can, in a collective way, we talked about this, how can in a collective way can the neighborhood be efficacious? What are the processes that enable them to do that? I keep repeating myself, I suppose, but just trying to emphasize what this is about to make you comfortable as you go through it. Now, he's got some articles out there that you have seen on social disorganization, which is just the inversion of social cohesion, but yet social processes nonetheless. What are the social processes that create social disintegration of a neighborhood? What are the processes that create social cohesion? Whereas we might say for social integration, social cohesion, residential ownership that creates an enduring connection to the neighborhood, as opposed to high number or proportion of properties in a neighborhood that are rental value. People coming in, passing through and leaving, but not connecting very deeply into the neighborhood, not buying into the neighborhood, not making a commitment to the neighborhood. One that we would say more socially disorganized. It has its own layer of organization, but nothing like what we would say would be social cohesion. So a real quick way to identify those would be in a neighborhood, in a city, do a mosaic of where a range of social neighborhood housing ownership and renter, and then looking at the coincidence of that in community health, you might find that there's less social cohesion in neighborhoods by definition that are rental properties predominantly, and you might find a different health feature, not quite so successful, shall we say, than one where families are there and embedded and residential ownership. So a lot of the article going on through that, social mechanisms in health, I'm on page 459. You'll see the mental distress, things that are familiar to us, and then we get into 2 or 3, 4 pages of listings again. Good literature review if you're interested in this kind of topic. To write a paper on this. And when you get over to page 465, there's methodological challenges, and these are apparent, I'm sure, already to you. How do we measure these processes? It's easy to do a proxy with census data, but how do you measure the processes? And as he says in here somewhere in the first paragraph under methodological challenges, what is causing what? Now, we are, you and I, practitioners and researchers. We are scientists, social scientists, and we're trying to understand this. So what causes what is a key question for us. What causes what helps. We got to think our way through this because that's how we construct our equation. We got a y out there that is health outcome. What's causing that variation? Well, we have worked our way upstream and downstream over the course of the semester already, trying to come to terms with that. So anyway, I think you can go on through that, and there's some more statistical kinds of ways that he's talking about that. Work your way through that. It's not as important, I don't think, to me, for you to really get your minds around the more statistical aspects, like this, the more in-depth statistical stuff that was in the Raudenbush-Sampson article. And I said you can look at it, and whatever you understand from it, take from it, but pay attention to the text, because that's really and what they're talking about here. You'll see that there are a number of pages where they talk about the more statistical features of this. We'll keep going along here. I'm just opening the pages. Neighborhood boundaries, I'm on page 470 there. It's back to the idea of, from the outside looking in, well, for one thing, it's what we were saying a minute ago. If we bound these politically with census tracts, are we really adequately or effectively capturing the boundaries of the neighborhood? Not likely. There's overflow processes, and there always have been. So when you view census tracts, it's just a proxy. We agree that we're going to do it. It's what we've got in front of us, and we make it work. And for the most part, it does work. But we want to get beyond that. So there's that boundary of how do you bound the processes. The other piece of it is you and me. We're outside researchers, practitioners looking at a neighborhood. What we see is a boundary. We see it as a boundary. But what we want to do is we want to get inside in a qualitative methodological perspective, listen to the voice of the people inside these boundaries, and see what they see. What they see is a horizon. Out to this point out to here is where my neighborhood is. Now for us looking at it, we might not see it that way. We might say, well, wait a minute, the census tract boundary comes along that street, and your horizon goes beyond that. A very interesting perspective for us to understand. Listening to what the voice of the residents say enables us to see their horizons and see the boundaries of the process in a much more effective way than we could see it, or we can see it, by looking at the outside in with the more formal boundaries of the census tract, which really constrain the view, shall we say. So I think you'll see that there are some very interesting things going on here. Spatial dynamics of child well-being. Sampson, when he focuses on research, he really focuses on child well-being. And it's a good thing. He's got some wonderful articles out there that you can, you could even pull from. I think there may be one or two in our set, but you could find Sampson out there with a Google research if you wanted to write a paper on child well-being for this comprehensive essay. You could do that. He describes spillover from neighborhooding. I'm on page 472. Dynamic aspects of social life, rather than focusing on static composition. What's the composition? Demographic composition. Static as in fixed from 2010, and then we use 2010 features all the way through 2019 before we do a 2020 census. But rather look at those things that are dynamic and as opposed to static. So I'm thinking you're probably getting the idea of what we're talking about here. I think that's about all I want to say about this. Read the article. Do read it. Because when we're thinking about fabric and social cohesion, we know that social cohesion is not bounded by census tract. If we're talking about neighborhood effects. Now there's a social cohesion, like here at the university, it's a social cohesion. We have a university community. In a sense, in the workplace, there is a community. When I used to make pizzas back when I was in graduate school, there were about 5 or 6 of us worked at night until 2 in the morning making pizzas and pouring beer for customers. We had a little community, an inner dynamic, a support system, a fabric, a network. And we often caught up after work or different times because we became friends. So community concepts at all different kinds of levels. Even though we're talking about neighborhood effects here, we have talked about workplace effects. We've talked about family effects. There are all kinds of ZI kinds of effects, but this is the neighborhood effect. So pay attention to it and keep your mind as best you can down at the local level to the neighborhood and see how these are. When we look at these fabric and social cohesion, we know there's spillover. It's not just contained within the formal boundaries. There's a process. Think of being in these neighborhoods and looking at the horizons and where they extend to, what people say, and there may not be agreement, but there's probably a consensus where they go from a neighborhood. Just like you would look at if you were going to do an analysis of workplace effects. They're not bounded by the building itself. The dynamic is, it may have something to do with the boundary if they're cubicles as opposed to isolated offices. Those influence dynamic in their own way internally. Lots of interesting things to look at how processes are influenced by geography, but really how geography influences processes and processes influence geography. So it's kind of reciprocal, I guess. So anyway, thank you very much. We've talked quite a bit, I think, or I have. I'm going to close this out and get it set up on YouTube and go up and look in the discussion and post a discussion. Go ahead and post a discussion thread for the social fabric segment 4 and a discussion thread for the project or your comprehensive essay. So be collegial about this and talk to one another. And if you need some individual consultation, please email me. And I'll be glad to give you whatever advice I can. I'm sure that whatever idea comes out of your mind and heart is going to be a good one. So all I will do is just support you in the development of it. All right, so you all take care out there. Tomorrow is Halloween, and be mindful in the dark of things that lurk about.